Speaker. I'm pleased to rise and debate on the motion before the House. Be it resolved that the Legislative Assembly denounce the federal government's effort to reduce the rates at which it reimburses the costs of providing healthcare services to Canadian Armed Forces members. Call on the federal government to immediately and fully reverse this decision, commit to no future changes, and provide the highest level of treatment for these members, and recognize the contribution of these members who bravely and willingly risk their lives for our country. And more specifically, I'm of course speaking to the Honourable Minister of Health's amendment, which calls for a full reversal of the decision insofar as I gather the federal government has announced a partial reversal. How did that come about, Mr. Speaker? Well, only because there's surreptitious, middle-of-the-night, secret effort to cut health care for members of the Canadian Armed Forces was revealed by whistleblowers in the Canadian Armed Forces and reported by Global Television 2 nights ago. Mr. Speaker, I stand here not only as Premier but also as a former Minister of National Defence and as the son of a former Royal Canadian Air Force fighter pilot and the descendant of people who have stood in our uniform going back frankly to the defence of North America, British North America before Confederation. And so I stand here as somebody who is immensely proud of the sacrifices and risks taken by our men and women in uniform. And I know that we Albertans have always had an enormous respect and great support for our soldiers, sailors, and aviators. And that has often been expressed by a disproportionately high level of military enrollment by residents of Alberta. And so, Mr. Speaker, given that context, I was shocked to hear the news earlier this week about the federal government's secret effort to cut basic health benefits for acute care for members of the military. As the Honourable Minister of Health has underscored, our soldiers, sailors, and aviators do not get to choose to where they are deployed. It is a condition of their service that they can be deployed anywhere across Canada or, for that matter, around the world. It is therefore essential that they have the certainty of seamless health care coverage that follows them wherever they may find themselves. Mr. Speaker, before the Chrétien government effectively shut down and radically reduced the military hospital network in the mid-late 1990s, there was a system of military hospitals where most of the clinical services provided to military personnel in Canada were provided at those military hospitals. However, as a cost-cutting exercise in order to reduce expenditures, the Canadian Armed Forces, the Department of National Defence, decided that it was more efficient, about 20-some years ago, to effectively contract out that domestic care for military personnel to provincial health systems, which essentially means that the Department of National Defence enters into service contracts with the 10 provinces, through which the federal government is responsible for reimbursing the provinces at their normal rates for the services that are provided. And in fact, Mr. Speaker, just on that point alone, we do know that there sometimes are gaps that our transferred personnel fall between because, for example, a soldier at Gagetown, New Brunswick, who may be on a wait list for surgery, or perhaps his or her spouse is, when they move to Alberta, they have to get to the back of another queue to access the same service. So I know that I and the government's liaison to the Canadian Armed Forces, the member for Leduc-Beaumont, have been in discussions with both the Armed Forces and the Department of Health to see if we can somehow resolve and mitigate challenges such as that. But fundamentally, the system has worked reasonably well for the past 2 decades for servicemen and women, where they've been able to access provincial health systems. Now, I gather the federal government has been the premise of the unannounced secret cut was that the provinces are supposedly charging DND too much for these clinical services. The truth is that the rates are the same as they are for any out-of-province individual or anybody not insured by Alberta Medicare. They're the same rates that we would be charging, for example, the Workers' Compensation Board when it buys health services from AHS. They're the same rates that a foreign visitor coming to Alberta that goes into a hospital or clinic would pay, or for that matter, a Saskatchewan resident who has not yet established residency here, and then we would bill that back to Saskatchewan through the interprovincial reciprocal healthcare billing agreements. So, Mr. Speaker, the rates are quite fair. They are not they're not set to generate some kind of notional profit for the Alberta Crown. They're set to essentially be cost recovery for Alberta taxpayers. So the effect of the changes that were made by the federal Liberals was effectively to impose those costs on Alberta taxpayers. Now, apparently, we estimate that was a cost of $2 million, which may not seem like an enormous amount of money in the context of a $49 billion budget, but across the country, it's quite a significant shift of costs from the Department of National Defence to provincial taxpayers. In the case of Ontario, I understand it's $10 million, so likely about 25 to 30 million nationally. But, Mr. Speaker, more deeply than that, this really shows a profound disrespect for the greatest Canadians, those who are prepared to, frankly, give up their lives in the defence of this country, our values and interests. And surely it is incumbent upon any government of any partisan stripe to prioritize, beyond everything, the support required by our women and men in uniform. And that's why the government has brought forward this motion, because we are so profoundly disappointed in the disrespect implicit in this secret decision by the Trudeau Liberal government. Mr. Speaker, although I only served briefly as Minister of National Defence for, I think, 10 or 11 months, I can tell you that, and during a time of fiscal constraint, a time when the federal government was actually, unlike the current one, focused on fiscal probity and balancing the budget. And so we had to watch every dollar that was spent. And even in that context, Mr. Speaker, let me tell you, nobody in the Department of National Defence of the Canadian Armed Forces approached me as minister to say, we need to cut the rates for health services for military personnel. And had they approached me about that, the conversation would have ended in a New York minute, Mr. Speaker. It would have ended right there and then, had they proposed such a thing to me as minister. And so I find this quite frankly shocking, that this was not, when I was minister in 2015, coming up from the system, even after rigorous spending and program reviews, even after spending had been reduced in certain low priority areas. Nobody had proposed what was just done by the federal government. And so I wonder, where did this come from? Mr. Speaker, and why was this done? An act of great insensitivity that also has the collateral effect of downloading costs to the taxpayers of Alberta. So, Mr. Speaker, I want to salute the Honourable Minister of Health for assuring our military personnel that regardless of the irresponsibility and cold-heartedness of the federal government on this matter, the Government of Alberta can assure all military personnel serving in this province that we have their backs, that if there's any diminution in federal insurance or rates for health benefits, that will not affect their access to clinical services in Alberta through Alberta Health Services. And, Mr. Speaker, I will just conclude by thanking members for their interest and support. I think it's regrettable the official opposition did not allow this matter to come before the House urgently yesterday. I urge all members to support this motion so united we may send a message to this federal government, a government that has done so much to inflict such deep damage on this province. And this is just yet one other example of, I submit, why we need a new federal government on October 21st. Thank you, Mr. Speaker.